psychologist at the British CBT and Counselling Service, and in this video I'm going to explain what happens in the first counselling session. The prospect of starting counselling can be quite daunting, but sometimes if we know what to expect, it can take the edge off our nerves a little bit. The point of the first session is for your counsellor or therapist to understand your version of the problem. So your version of anxiety, depression, eating disorder. They will have seen other people with those problems, but to properly help you, they need to know the specific details of your problem. You need to be quite careful here because you don't want to just go to somebody who is doing the same thing with everybody, offering an off-the-shelf treatment. It's not going to work. It needs to be individually tailored to what you need. So to do this, to individually tailor the counselling to you, your therapist should ask you a selection of questions. There's usually 4 types of questions. The first type of question is so that the therapist can understand the severity of your symptoms. So they will ask you to describe them and what makes them better and what makes them worse. They will then move on to looking at the history of those symptoms. When did they develop? What was happening around that time? They will ask you about similar problems that you might have experienced in the past. And here, they're starting to try and understand why you have these problems, why they developed in the first place. The third type of question is building on the why question, why you have these problems. So they will ask more general questions about your life, friends, family, work, hobbies, these sort of things. And then finally, they will ask you a little bit about the things that you've already tried. So maybe the professional help that you've already tried, or maybe just some of the stuff you've tried at home, some of the things you've read on the internet. And here, they're trying to think about or work out what type of treatment would be best for you, because different things suit different people. Then, using all of this information, they will offer you an explanation for why this is happening to you and why it hasn't just gone away on its own. And then they'll give you a plan of action. So what they're going to do, or what you will do together to make things better, to make you start feeling, or to help you start feeling well again, to feel like yourself again. In this first session, there also should be plenty of opportunities for you to ask questions, and whatever questions you need to ask to make yourself feel comfortable. It might be about the therapists themselves, their experience. It might be about the different types of treatment. It might be questions about things that you've read on the internet. So that's basically what you can expect in the first session. Hopefully, I've answered all of the questions that you had. But if I haven't, please post them in the comments below and I will do my best to answer them. In the next video, I'm going to talk about different types of therapy, in particular CBT. On this channel, I talk about everything to do with mental health and therapy. So if this is something that would interest you, please subscribe, like the video and share it with your friends. I'll see you soon.